Mr. Murphy.
Thank you, Mr. Chairman. I just want to say thank you, actually, professionally to both of you gentlemen. Dr. Fauci, I followed your career since the early 80s when you made such fantastic and landmark discoveries with HIV, and it's really put forward something today now that's manageable. So thank you from our community. Being the last one to speak, I always have to figure out which questions that folks have already asked. But let me go back to one of the things. My colleague pointed out the anti-scientific movement these days, and I actually think that's a major problem. I saw last week that people are now starting back on the flat Earth agenda. And I want to go back to the anti-vaccine movement that's going back in our country. I wonder if you could really speak to that, what it's done as far as populations at risk, and where do you see that going in the future? Because it is a major issue these days.
Well, certainly, I think there are pockets where individuals are talking with one another, some schools, that kind of a setting where folks are hearing from each other rather than looking to see what the science base is or listening to physicians. And so those pockets, I think, can lead to more and more children, for instance, not getting vaccinated for school, to get into school. I think it's important for us also to recognize that people get their information in multiple different ways now. And so for us to be nimble on how it is that we get the science-based information, the evidence-based information to those folks, identify what their needs are, and then provide them the information that they need. But until you address those specific groups, I think, with information that is valid to them, I think it's going to be actually very difficult.
Thank you. One other issue I'd like us to revisit is Ebola. I don't think people in the United States really understood the gravity of what would have happened if that had gotten into Lagos or any of the other places in the future. And I was wondering if you could talk a little bit more just about the vaccine with Ebola. Does it mutate on the level that the other ones do? And can you, just for edification, just explain to folks the infectivity rate of the Ebola virus versus the HIV virus, for example? I know it's on a multitude scale more infective, but I think giving an example would be helpful.
Well, Ebola, unlike influenza, which drifts and mutates, is pretty stable. It's an RNA virus, so there's always mutations, but the mutations have not proven to be functionally relevant. So if you do a sequence of Ebola in a strain in West Africa, which was Ebola Zaire, the Ebola that's now in DRC is still Ebola Zaire. There are different types of Ebola. There's Ebola Sudan, Ebola Zaire, and others. But within Ebola Zaire, which is the one we're dealing with right now, it really has not been a problem that it has mutated to the point of being functionally relevant. So you can measure point mutations, but they don't change anything about it. I think the question you asked is, what is the relationship with the vaccine? The relationship with the vaccine is that the vaccine has worked, and any change in the virus has not had any impact on the vaccine. So it looks pretty good. So we're, as I mentioned a little bit earlier in the testimony, we've now distributed over 250,000 vaccinations in the outbreak in the DRC. Second part of your question is the issue of how it's transmitted. In an untreated, unvaccinated arena, such as what's going on in the DRC right now, that is, the mortality of that is about 70%. It's transmitted only by direct contact with a contaminated bodily fluid. Right. And that was really important. So if someone gets Ebola and they're incubating it and they get a fever, but they're not having diarrhea, they're not having bleeding, they're not vomiting, that person is really quite non-contagious. And that's the reason why there wasn't a concern of people back when the patients in Texas got infected. There was a concern that those 2 nurses were infecting people, and they were not. Whereas when you get something like influenza, influenza is transmitted by the respiratory route. And there's a window of when you're actually not really very sick, when you can actually transmit it because you're shedding virus for a period of time before you get sick and after. So there really is a rather substantial difference in transmissibility. It is tough to get infected with Ebola unless you have direct contact with a really sick person. whereas you can get influenza on an elevator when the person next to you sneezes. So that's a big difference.
Thank you. Thank you, Mr. Chairman. I'm going to yield back my remainder time to Mr. Posey.